On healthcare, there's a slew of proposals floating around from Republicans. Are you confident that Republicans will be able to coalesce around one plan? And then...
No, I'm not. No, the only way for us to be able to lower the cost of healthcare is to do another reconciliation bill. We don't live in la la land. I know some of my colleagues think that we can sit down with some of my Democratic colleagues and we can reach an agreement on fixing Obamacare. I wish I could be that sanguine. I don't. I think there are some Democrats that are in very good faith, but most of them just want to keep the cost of health care as a campaign issue for the midterms. And the truth of the matter is that Obamacare is broken. When we adopted Obamacare, we were told that insurance would be cheaper and more accessible. It's been neither. We were told it would make our lives better. It's made our lives worse.
Welcome back to the channel. Today, we're analyzing a recent interview featuring Senator John Kennedy, where he speaks candidly about healthcare reform, Obamacare, internal tensions within the Republican Party, and some legislative priorities that didn't make it into the final bill. I'll walk you through what he said, why it matters, and how it fits into the broader political landscape, all from a neutral, analytical perspective.
The damn thing's broken, and we ought to address it. But the only way that I can see us addressing it is through a reconciliation bill. And for the life of me, I cannot figure out why my friend Senator Thune will not agree to do another reconciliation bill. I just can't. It's beyond me. Why would you give up the chance to put together sound social and economic policy when you only need 51 votes to do it? Why would you give that up? It's almost, I don't understand it. But I'm going to keep pounding him like he stole Christmas.
Does that mean come January, those 20 million Americans are going to see their insurance premiums skyrocket and there's nothing Congress can do?
Well, there is something Congress can do, clearly, but will the premiums go up? You don't have to be Euclid to figure that one out.
You're saying it's almost assured to happen?
No, I'm not saying that at all. I answered your question. Don't put words in my mouth, man.
Senator, on the NDAA, both the House and Senate version included a provision that would institute coverage for IVF under the military's healthcare system, TRICARE. That didn't make it into the final product.
Yeah, I regret that. I wish they had put it in there. I wish also that they had included our cost of housing reform as well.
Can you expand on the IVF portion of why you wish it was in there?
Well, I support IVF. I think the American people support IVF. For the life of me, I don't know why they didn't include it in there. I think they made a mistake by not including it in there. Okay.
Thank you, Senator.
Thank you.
See you guys.
Right off the bat, Senator Kennedy is asked whether Republicans can come together around a single health care plan. His answer is unusually blunt. No, I'm not. From a policy analysis perspective, that honesty reflects a persistent issue within the GOP. For years, Republicans have been aligned in opposition to the Affordable Care Act, but divided on the specifics of how to replace or reform it. The ideological range inside the party from libertarian to more government-friendly conservatives makes consensus difficult. Senator Kennedy is essentially acknowledging that problem directly. Kennedy argues that the only workable way to bring down health care costs is through another budget reconciliation bill. Reconciliation allows certain budget-related legislation to pass in the Senate with just 51 votes rather than 60. It's a powerful tool when bipartisan cooperation isn't expected. His emphasis on reconciliation signals that Republicans don't anticipate meaningful Democratic support on health care adjustments, which is consistent with the polarized environment surrounding the ACA. Kennedy voices skepticism about negotiating with Democrats to fix Obamacare. He acknowledges some Democrats act in good faith, but suggests most want to preserve health care as a political issue heading into the midterms. Neutral analysis here. Claims like this are common from both parties. Each frequently believes the other is strategically withholding cooperation, whether accurate or not. That mindset alone makes bipartisan progress harder, and Kennedy's comments reflect the entrenched distrust shaping healthcare policy today. Senator Kennedy repeats a long-standing Republican argument that Obamacare is broken, that it didn't make insurance cheaper or more accessible, and that it has worsened people's lives. As a neutral analyst, it's worth noting that data on the ACA's impact is mixed. Many Americans gain coverage, but premium increases have hit some markets hard. Effects vary widely by income, state policy choices, and insurance market stability. Kennedy's comment aligned with the Republican critique, and they explain why he sees urgent need for reform through reconciliation. One striking part of the transcript is Kennedy's frustration with a fellow Republican senator who he says refuses to support another reconciliation bill. This moment underscores that internal GOP disagreements aren't just about policy, they're also about strategy. Even when a party has the ability to pass a bill with 51 votes, it still needs unity. Kennedy's exasperation, including his colorful expression about pounding him like he stole Christmas, illustrates how much tension exists inside the party over how aggressive lawmakers should be on health care reform. When a reporter asks whether 20 million Americans will see premiums skyrocket in January, Kennedy avoids making specific predictions and pushes back against having words put in his mouth. From an analytical standpoint, this is predictable. Healthcare premiums depend on many factors: insurer decisions, federal subsidies, state marketplaces, and economic conditions. Politicians on both sides typically avoid firm projections because they can backfire. Kennedy's caution reflects that political reality. Kennedy also expresses disappointment that two things didn't make it into the final legislation: IVF coverage for military members, housing cost reform provisions. His regret is telling. It shows he's not merely defending the bill as is. IVF coverage for service members has bipartisan public support, and Kennedy emphasizing this signals that some issues could be avenues for cross-party agreement in the future. The housing provision mentioned also speaks to a broader trend. Lawmakers increasingly link healthcare debates to larger affordability concerns faced by Americans. In summary, Senator John Kennedy's comments shed light on several key dynamics: Republican divisions on healthcare strategy, ongoing distrust between the parties, frustration with legislative tactics, and concern about missed opportunities in policymaking. Whatever your political leanings, understanding these dynamics helps explain why healthcare reform remains such a difficult and polarizing issue. Thanks for watching this breakdown. If you found the analysis helpful, be sure to like, subscribe, and comment with what political topic you'd like examined next. See you in the next video.